In recent months, a staggering 98% of pregnant women in hospital with COVID are unvaccinated. This is incredibly sad because what should be an exciting time could quickly become a very scary time for these women. I'm Nadia Ali, a mum of one, and I get asked questions by pregnant women, those breastfeeding, and women wanting to conceive in the future about the COVID vaccine. And it appears I'm not the only one on social media getting these questions. Some of us have had our vaccine, and some of us are still to take up the offer or have questions that they would like answered before they do. So we've teamed up with excellent healthcare professionals to get accurate answers to some key questions on the vaccine, particularly for pregnant women and new mums and mums-to-be. So here we go.
What are the benefits of getting the COVID vaccine during pregnancy?
Having the COVID-19 vaccination is the best way for you to protect both you and your baby. Whilst it's rare for pregnant people to become seriously ill from COVID-19 infection, it may be more likely in the later stages of pregnancy. And this could also increase the chance of your baby being born prematurely, which could affect their long-term health as well.
Why did the advice change on whether pregnant women should have the COVID vaccines?
That's a really good question. So, real-world robust data from the United States has shown that around 120,000 pregnant people have already been vaccinated against COVID-19, mainly with mRNA vaccines such as the Pfizer-BioNTech or Moderna vaccine, and no safety concerns have been noted. As a result, the Joint Committee on Vaccines and Immunisations have updated their guidance.
Which COVID vaccine should I get if I'm pregnant?
If you are pregnant, the Joint Committee on Vaccination and Immunisation has advised it's preferable for you to be offered a choice of two vaccines, either the Pfizer or the Moderna.
When during my pregnancy should I have the COVID vaccine?
You can have your vaccine at any stage of your pregnancy. There's no need to delay the jab because of being pregnant. I had my first dose of the vaccine just before falling pregnant, and then I had my second dose at the end of the first trimester. We're both doing really well.
Oh, okay. Is it safe to have the COVID vaccine while breastfeeding?
This is a question we get asked a lot. Yes, it is safe to have the vaccine if you are breastfeeding. The Joint Committee on Vaccination and Immunisation, as well as the World Health Organization, have recommended the COVID vaccine can be taken whilst breastfeeding.
How long should I wait in between getting the COVID vaccine and other vaccinations during pregnancy? For example, if I wanted to get the flu vaccination.
It is really important that you have all of your vaccines in pregnancy, and that includes the whooping cough vaccine and the flu vaccine in the winter. These can be given safely alongside the COVID-19 vaccine as well. You don't really need to delay, but you might like to leave around 7 days to avoid any confusion about common side effects of the various vaccines.
Could the COVID vaccine side effects impact my baby's development or health?
The COVID vaccines do not contain any ingredients known to be harmful to pregnant women or their babies. None of the COVID vaccines being administered in the UK are live vaccines, so they cannot infect you or your baby with the virus and are considered safe to receive during pregnancy.
What should I do if I already had my first dose of AstraZeneca vaccine?
If you've had your first dose of the Oxford AstraZeneca vaccine and are due to have your second whilst pregnant, you can talk to your GP, midwife or health worker about the second dose.
If I'm getting vaccinated postpartum, how long after giving birth should I wait to receive the jab?
If you decide to wait until after you've given birth before getting the COVID vaccination, you can get the vaccine as soon as possible after the end of your pregnancy.
What's been your experience treating pregnant women with COVID?
I, like a number of my colleagues, have treated many pregnant people with COVID-19 infection in pregnancy. I've been involved in their care and watched them deteriorate. I've seen them admitted to a labour ward for treatment and support, and then been escalated to intensive care. I've seen babies born prematurely as a result of COVID-19 infection, and this is preventable by having vaccination.
Can I have the vaccine if I'm undergoing IVF treatment?
Yes, you can. The British Fertility Society says that as some people may experience minor side effects after the vaccination, you may want to leave a few days between your COVID vaccination and any treatment procedures such as egg collection or embryo transfer. It's important any symptoms may be attributed correctly to the vaccine or the treatment procedure. You can also speak to your medical team for tailored advice surrounding your care.
Could the COVID vaccine affect my fertility?
These claims are not supported by any data. Looking at evidence we have from other vaccines that are routinely given as well, such as the flu vaccine, which is non-live like the COVID-19 vaccine, is perfectly safe and doesn't affect fertility, so there's no reason to think that the COVID-19 vaccine will. This theory that having immunity to the spike protein will affect fertility is also not supported by any data.
Could COVID vaccine affect my period?
Some people have reported heavier periods after their vaccination. The side effects are often mild and shouldn't deter you from getting the jab. Many people experience a temporary change in their periods during their lives, and it's possible these two could coincide with the vaccination. If, however, these changes persist, or if you have any new vaginal bleeding after the menopause, please see your doctor.
I've known people who have miscarried in the past and are trying to get pregnant again. Should they wait until after giving birth to get the COVID vaccine?
No, there's no reason to delay having the COVID-19 vaccination, as there's no evidence to suggest that it will harm your baby or cause any complications in your pregnancy. As well as the COVID-19 vaccine, it's really important that pregnant women and people also have their flu jab. The flu jab's always been recommended in pregnancy, but it's particularly important this autumn. Now that people are socialising more with fewer restrictions in place, vaccination is a really important way of protecting you against serious illness and hospitalisation. Experts are warning that this year flu poses a greater risk than previous years, so if you're pregnant then please do get your flu jab as soon as possible.